Hello, YouTube. This is Dr. Tahir from Youthful Medicine. So, today I'm going to talk to you about a patient that I saw earlier today. And she's a 71 years old female who has what I called a hidden risk of metabolic syndrome. And she comes to me for evaluation for joint pains and osteoporosis. But what is interesting is that she is very active. She is walking about 6 miles a day on average. She has a BMI of 20. So she is by no means considered an obese patient. But she has elevated lipid profile. She is post-menopausal woman, so her estrogen protection is no longer there. And what this she falls into the category of the hidden risk of being a skinny fat person. So in this video I will be talking about the hidden dangers of elevated lipid profile in postmenopausal women with normal BMI. It is often referred to as skinny fat. Despite having normal weight and BMI in the target ideal range, these women may carry visceral fat, a key marker of metabolic syndrome, and it increases the risk of cardiovascular disease. How can we recognize those? Apparently, if we don't check it, we would not know it. So, this patient, we were talking about longevity, anti-aging, and how to improve the outcomes of her current life, and I decided that I should check her visceral um, fat, and also try to get a lipid profile. I don't have her DEXA scan results as yet, but I will update you guys later when I have it. But so far, I have her lipid profile. Her total cholesterol is about 230, and her LDL cholesterol the is about 130. But her HDL and her um, triglycerides are in her 80s, high 80s, like 88 and 90 respectively, triglyceride and HDL. So they are really good. So I am often of the concept that if you have a marker of inflammation or high lipid profile that has been associated with risk of early death, treating it is important, especially if you have a patient who could benefit with intervention. Some patients, let's say if this patient was 30 years old or 50 years old, I may not embark on the treatment, but she is 71 years old, and I hope that she would live up to 100. If I don't intervene now, I may lose the chance of opportunity or window to prevent her to have stroke and heart attack. So in my longevity and anti-aging practice, I do want to discuss that this is something that I address with patients. Again, what are the causes of visceral fat, type of fat that surrounds the internal organs um, in patients who have abdominal obesity inside the abdominal cavity, and which is associated with many risk of heart disease? Well, one of the causes is poor diet. Poor diet, like high sugar intake, consuming food, refined sugars such as carbohydrate, like simple carbohydrates. So you're talking about sugary drinks and pastries and donuts and all that good stuff. It can lead to increased fat storage and including visceral fat. Processed foods. I talk about that in my patient population a lot. That diet high in processed and fast foods is often rich in trans fats and contribute to inflammation and visceral fat accumulation. This patient obviously is not taking excessive calories. Her BMI is really good. So I'm not gonna say that she's taking too much calorie, but if people who are exceeding their daily calorie requirement. Another risk factor for development of visceral fat is that if you have lack of physical activity, again, this patient, interestingly enough, walks about 5.7 to 6 miles on average. She showed me on her app that actually she does not sit like idle. She's walking, she's doing activities. Another thing that I would like to bring it to your attention is hormonal age. So that's why anti-aging is always associated with assessment of your hormones, and also hormone replacement therapy when appropriate is important, because aging, as people age, their metabolism slows down and hormonal changes occur, like low levels of estrogen, that's the female hormone estrogen, in women, postmenopausal women, and in testosterone in men. They can lead to increased visceral fat. So men, they get through their phase called andropause, and women go through their phase called menopause. Excessive cortisol, stress hormone, chronic stress elevates your cortisol level and leads to fat storage around your organs, in your mid abdomen region, right, where that stubborn fat sits, and it's just some genetics play a role too. Other factors associated with this is poor sleep, excessive alcohol consumption, because excessive alcohol is associated with increased fat accumulation, visceral fat, commonly referred to as beer belly. Alcohol increases calorie intake and affects fat metabolism. It also hinders our ability to stop eating when we need to stop. So other factors like smoking, insulin resistance, not in this population, but in younger patient population, I've seen who have polycystic ovarian syndrome, which I'll talk about it at a later time. Poor gut health, such as people who don't eat probiotic-rich food and more processed food, they lead to more dysbiosis, which can contribute to weight gain. And also, poor gut health is related to inflammation, which encourages fat storage. In patients with chronic inflammation, systemic inflammation such as autoimmune diseases like rheumatoid arthritis, if not addressed properly. So, in summary, visceral fat is particularly harmful because it surrounds your internal organs, and it's linked to heart disease like cardiovascular diseases, type 2 diabetes, and metabolic syndrome. And reducing the visceral fat requires a combination of healthy diet, regular physical activity, stress management, better sleep, and also, when needed, intervention with medication. So, on this patient particularly, I advised her to consider starting a low dose statin as a preventive method. I want to see her numbers of LDL below 70. And with her good lifestyle and diet, and with this medication, I think we'll be able to ensure that she'll be free of heart attack and strokes for a long time. All right. Well, I hope this was helpful. Until next time, um, I will ask you to subscribe to this channel if this information is helpful to you, or share it with your loved one if they find it helpful. It will give me an idea of if this information is useful for people, and should I continue to produce more and more valuable videos. All right. Take care. Bye.